It is time for Health Beat. The American Academy of Pediatrics is taking the steps to eliminate race-based guidance. And prior to last month, pediatricians used a set of racial guidelines to label which patients could be more susceptible to certain conditions. For example, urinary tract infections or newborn jaundice. Well, ABC 10 health expert Dr. Pyle Coley says for a long time, doctors thought the biological differences in certain races could change the way you proceed with a patient. But now the AAP is raising awareness on how that's not the case. She says the difference is really in the rate of detection, socioeconomic status, and access to care. It's a change Dr. Coley says is long overdue.
I think the American Academy of Pediatrics is really setting a precedent here for the rest of the organizations in medicine, the professional organizations, to sit down and take a frank look at their guidance, especially as it relates to race, and really ask ourselves the question, is this real science or is this pseudoscience? And is it time to revise that guidance so that we can really help to narrow the disparities that exist in healthcare?
Well, Dr. Coley says doing so is important because at this point, some of our population is getting suboptimal care, and that's partially due to the history of using this race-based guidance.